Very good evening and a warm welcome from Asian College of Teachers. My name is Shaunak and I welcome you to yet another YouTube live show. The topic of today's discussion is child language disorder. Now, in general, those who have been watching Asian College YouTube Live, I try to make a kind of an introduction and then we start with the mainstream of the program into the main course. But because today's topic is something which is very, I would say, very serious and carries a different kind of a gravity. So I would like to welcome our speaker directly because we have a lot to learn. We from Asian College welcome Ms. Divya. Ms. Divya is a practicing speech therapist. She has completed her bachelor's of audiology and speech language pathology from Manipal College of Health Professionals. She is skilled in speech pathology and has expertise in pure tone audiometry, speech audiometry, behavioral observation audiometry, and visual reinforcement. So, first of all, welcome Divya to this special YouTube live show. Welcome from Asian College of Teachers.
Thank you. Thank you for giving me such a good platform to convey all those child language disorders. And basically, what does language means? Language means a mode of communication. So, in mode of communication, it includes both expressive and receptive mode of communication. So, in child language disorders, it includes mode of receptive and expressive. So, what does a reception means for a child? So, reception is nothing but understanding capability of a child. So, the child needs to understand before he starts speaking. So, example, if you wanted to make the child to take a pen from the table, the child needs to understand pen as well as table and the meaning of take. Then only the child can able to convey the thing. So reception is nothing but the understanding level. So what comes to the expression? Expression is nothing but the speaking level of the child. So if the child wants to communicate something or child needs to convey any messages, it all depends on the expression of the child. So
Okay, yeah.
yeah.
So Divya, before this is definitely a good way of learning. But before we get into this, what is keeping me a little bit enthusiastic is that if you can tell me that as your qualification says so, so pure tone audiometry speech. I would like to know what actually it is, and if you can give us some example.
Okay. Pure tone audiometry is nothing but the audiometer, which is audiometer is nothing but an instrument to assess the hearing testing. So via
Okay.
pure tone, okay, yeah. So via pure tone audiometry, we assess and diagnose the hearing thresholds of from including the children to adults. So speech, or there is another field called speech audiometry, where we assess the speech recognition thresholds as well as the speech identification, discrimination, which all includes in the speech audiometry.
Okay, so that means you are saying that those people or those children who are have got problems in terms of speaking only, you identify them.
Yeah, most probably when it comes for a child who having a language disorder, to assess a speech audiometry as well as pure tone audiometry. Why? Because children who have hearing loss might be also can have a problem in child language. So we do
Okay,
assess pure tone audiometry for them.
okay. So when we talk of problem in terms of speaking, what I'm trying to get hold of that and let the our audience also know. So, for example, we are speaking, right? So a child, for example, right from the childhood, they grow, they babble, and then they slowly learn the words. So stammering is also kind of a problem, but I think that you don't consider it to be a disorder.
Huh. Yes. Why? Because stammering is can be many causes. Stammering root can be having many causes. It can be psychological, it can be neurological, it can be hereditary. So stammering can be an issue. It also can be a disorder, but we can blame it as a disorder. It's a
Okay.
condition.
Okay. So, what is the kind of, for example, when a child is speaking as a therapist or as a doctor, I mean to say, what are the initial signs? I mean to say, what are the ways in which we will understand that yes, he or she has got a problem? I mean to say, will the sounds be different, or will be a problem in terms of opening up the lips and speaking? So I just wanted to know that how actually you identify that.
In stammering, we actually, have a collapse with cluttering and stuttering. We name it as stuttering. So,
Okay,
any people, including us, if we have a problem, in speaking, we use this like, that's all comes under stuttering. For when it comes
okay,
to a child or adult, or when it speaking in when a person who have stuttering, speaking like example, my name is Divya. The person will be saying like my name is start yeah. So you can
okay,
see the way of the speaking. Like it has repetition, it has prolongation, it has blocks. So that's a
okay.
main core behaviors or core features of person who stutters.
That means only special teachers, I mean to say people like you would be able to make the difference between, stammering and what exactly is the disorder.
Yes, yes, yes. Yeah.
Okay, okay. So my first question is that this very example that you told, I hope the audience who are watching us do not take us wrong, because we are just citing examples. This is nothing to hurt anybody's sentiment out here. So is it that it falls under receptive or expressive? This the way you told, yeah.
Stuttering is not a language disorder, it is a fluency disorder. It's not
Okay,
dependent on a language. So, a person who is stuttering, having reception and expression will be age aggregate or normal. So, it is a
okay.
fluency disorder. It all depends upon the speech. So,
Speech, right.
otherwise, when it comes for children who are in autism or ADHD, global developmental delay, CP, that all comes upon the language disorder. Whereas stuttering is a
Right.
speech disorder. It's a fluency disorder.
Okay. So I mean to say, what would be the receptive language disorder? Can you just give an example? Receptive and expressive, what you were telling.
Okay. So we can't have a disorder for receptive. Like receptive expressive language disorder can have for like normal children who have lacking stimulation. So if the parents are working and if the parents are having no time to take care of the child, might can have a reception expressive language disorder. Whereas
Okay.
no autism or no learning disability or no ADHD cannot be a factor, whereas it is more associated to autism, learning disability, or ADHD, global development delay.
Okay.
But
Right.
when normal purpose can also have receptive expressive language disorder or else language disorder.
Okay. So I mean to say, what would be the right age when it gets arrested? I mean to say, as a parent, I mean to say, when will be the right age when I can identify that this is a disorder and I need to consult with an expert?
Okay, so it's a question which arises more in my profession. So basically, we in brain development, 1 to 5 years, it's a critical period. Okay, so brain
Okay.
have a special function, it's plasticity. Okay, whereas then we can unlearn and learn things quite fastly. So 1 to 5 is a critical period of a child. So
Okay.
basically, if a child is having autism, like virtual autism or a normal autistic child, he must be showing or he'll be developing his behavior after 2 years of age. So you can see the speech milestone, like 0 to 6 months. 6 months is a babbling period. There, as a child babble, like child communicates through babbling. So
Right.
when it comes to after babbling, it comes to when it comes to 1 year of age, child starts speaking the first word of amma or dad or
Hmm.
2 years child will be incorporating two words like mama give or I need to go. So there is a hierarchical methods of speech that's named as a speech milestone. So we
Okay.
have to check like if the milestones are proper. So if it is
Okay.
not, you have to be a little bit cautious. Why? So after 2 years of age, if the child is not able to, communicate things, we have to be suspicious about that. And three is a uh, good age, like, 3 is a age where the parents got to get to know the child is having problem. Child is having a problem,
Right.
like yeah, 3 years child may be this is telling a story, small stories or conveying small things. So if at all child is not speaking or we can able to understand and undergo that child is having a problem. So 3 to 5
Okay.
is the uh, most typical time that parents get to know the child is having a problem. So
Okay.
before, yeah, early intervention is the best thing. So 1 to 5 is the best period for therapy, and the parents identify more in the age of 3 to 5.
Okay. Now, one thing I just came out of mind. I hope you won't mind asking this. That there are children who speaks a little bit late. I mean, it's a normal speaking, but they start speaking a little bit on a later age. Will that not be considered a disorder, or what would you say on that?
Uh, See, it's like it's a late talkers. Uh, when it comes to a normal child, he might be having his reception good, where only the
Okay.
expression will be lacking. When it's with a normal child, when he lacks the stimulation or when he is put onto the screen time, he must be a little bit odd in his reception. Whereas for the normal child who's basically is a late talker, his reception will be good. But the only expression will be the lacking thing. When it comes to ADHD or autism, global, or Asperger's syndrome and all, there we can see the eye contact is lacking, attention is lacking, sitting is lacking. Not only the speech, the other factors are also will be lacking
Right.
in.
Lacking.
Yeah,
Okay.
yeah.
So it is a complete kind of a symptoms taken other things together, then we identify that. Okay. Now we will come to the next point, which I think all the audience are waiting. What causes language disorder? But before going that, I have a small question to you. A child grows up after a certain age, say for example 6, 7, and 8, then suffers through an accident, might be falls from the stairs, etc. Due to that, is it possible to get a language disorder, or it happens for a different reason?
Yeah, it can be happening for a language disorder. It's named as, aphasia condition. Whereas we adults who can fall into a language disorder after stroke or after traumatic brain injury or after
Okay.
cancer or something. So there is a childhood aphasic disorder where child who's falling from stairs or having a traumatic brain injury, they're hitting the lobes, which is needed for language in the brain, can have a language disorder.
Okay. So, what are the primary causes, Divya, if you can just enumerate and tell us? Primary language disorder reasons.
Mm, So language disorders reason is basically, when it comes to a child who is having a late talking. Okay. First, I'll distinguish between a late talking and one who have, autism or ADHD. One who is a late talker, where the language disorder comes only because of the pure stimulation. Okay.
Okay.
First generation. How we learn to speak, how we learn to speak with the intonation or prosody while where our ancestors had. How? Because we learned from them. We learned the language from the ancestors. We learned the language from the parents. Likewise, one who having a normal speech and language delay lacks a stimulation, and develop a late talking. Where, when it comes to ADHD or autism, there are many factors which is affecting them. Like if a mother is falling, when she's carrying and she's falling sick, or she's undergoing some medications, it can affect the child. So it can be neurological as well. If a mother is under stress, or mother is having a cholesterol, BP, or if at all my mother is normal after delivery, if a child is having a low birth weight, or birth cry is delayed, these are the main factors which can be a query that child can develop autism. There are no preventive ways that this is a main reason this child develop an autism, or this is a factor that leads to autism. There are many factors leads to autism,
That was right.
oh yeah, and
That
in
means
autism.
that both of them can happen. I mean to say they can carry it prior to their birth, and it can happen due to accident also. Now,
Yes.
the recent researchers, I don't know, I'm a little bit curious. Does it suggest, Divya, that is there any kind of a genetic disorder which has been carrying on from their forefathers, and that is the reason that a child has a disorder? I
Yeah, it can also be genetically if a child's ancestors or parental side, it can be hereditary also, but it's not proven that it can be or it has to be. It can be.
okay,
Varies from one person to other. We do take that as in history. When we assess, we do take that count also, but it's not like mandatory that if a child's father had
You,
this problem, child can
YouTube
also.
live এ আছি yeah so sorry
So it can be also be a factor that genetic do play a role in that as well.
okay okay so you are so there are a lot of ways in which we can really understand those things. Okay, one technical term which I'm really willing to you to if you can explain it with reasons, examples would be, what is a Down syndrome?
Okay. Down syndrome condition is it's a other disorder. Like, it's a chromosome. We do have a chromosome, right? So in Down
Okay,
syndrome condition, it's a deletion or depletion of 21 chromosome, trisomy. So that is the main reason a child who develop a Down syndrome. So Down syndrome children are very evident by looking at the features, whereas in autism or
okay.
ADHD child we can't recognize, or a normal for a normal person we can't identify as a child is having an autism or ADHD. Whereas the Down syndrome children we can quietly identify that's a Down syndrome, where the
Oh, okay.
features are separate and it's different.
How will you, I mean to say, what happens really on a layman's language if somebody has got a Down syndrome?
Huh. Down syndrome condition is, which I've told you, where the chromosome is there, right? 21 chromosome. In the number of 21 chromosome, there can be a change in the number of chromosomes. There is a deletion or depletion in the 21 chromosome. Okay. That leads to Down syndrome characteristic. Okay.
Okay,
Where the facial features is very quite evident, but the tongue is a little bit rigid. The hands and legs, fingers are a little bit small and flat. The hair is tend to be straight, uh, and the tongue movements are restricted. So this is
okay.
I'm saying is that chromosome number 21 is deleted or depleted, or any abnormalities in the Down 21 chromosome leads to Down syndrome.
So I mean to say, will that person have one problem in walking as well as talking?
No, walking, sometimes if it is having a toe walking, the uh, palm and the legs, fingers are rigid and small. So for
Okay,
some children, they have a problem in walking, but not for every children. Basically, they have a problem in speaking. Why? Because
Speaking. Okay.
why? Because the tongue movements are restricted. They can also have be a receptive as well as expressive language disorder.
Okay, that means what you are telling is that a child might have a Down syndrome only, and that can also lead to a speech disorder. And it can also happen that a child doesn't have a Down syndrome, but just a language problem that can also be considered as a disorder. I mean, it's not every child will have a Down syndrome and then only will have a disorder. It is not like that.
Every in Down syndrome children will have a problem in speaking. Why?
Speech.
Because
Okay.
yeah, why? Because the movement of tongue will be restricted. So
Right. Right.
yeah, so movement we have to teach them that what is a movement, and we have to teach them how to pronounce, produce each and every word. So for Down syndrome children will most probably with 99% of the children will have a issues in the language and speech.
Okay, okay. So it is generic that speech problem means that it will they will have a Down syndrome.
Like not every speech children Down
Right.
syndrome children will have a problem in language and speech.
Okay. 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 So my next question. So I would just like to remind anybody who is joining in late in our YouTube live, we are in conversation with Ms. Divya. She is a practicing speech therapist, and we are learning a lot of new things on the topic child language disorder. Okay. So the thing is that now, suppose we identify the problem. So, what would be the first course of action for a parent? Because in general, what happens, there is a tension, there is a problem, there is a, I would say, a mental shock more to the parents rather than to a child, right? So, as an advisor, what would you suggest that a parent should do?
Okay. So if at all you are identifying that your children is having a speech delay, please do not Google it. Okay. If you're Googling, ah, this is very
Right.
sarcastic, but it's true. Hence, if you're Googling it, we'll have an n number of tensions we'll be getting. Where
Tensions, absolutely.
this, that, and the parents are full. Parents will be, clouded with different things and
Options, and yes, and not only true for special children, Divya, I can tell you, whenever we have any kind of a disorder, I mean to say stomach upset or headache, immediately we Google and we get a huge amount of options, and we now substitute ourselves as a professional doctor, go to the medicine shop and start taking those drugs, which indirectly would cause a lot of harm to us. Yeah, so this is a very important point I would like to tell to our audience is that what Divya is telling is that let us not Google whenever we identify that kind of a disorder. Yeah, please, what would be your next suggestion?
please do not Google it. Like, if at all, why? Because the child might be, might be a late talker. If we are Googling it, will be having different several tensions, the different several queries will be getting. So please don't Google
Right,
first. And the very next thing you can do it at consult. If many parents might not be knowing that whom should they consult to, if they have a query in that, if a query in child developmental thing, then we can consider a pediatrician. Okay, if at all,
right,
yeah, or else they can consult to a speech therapist or an occupational therapist or a child psychologist. These are the persons who can help you out and knowing the condition that the child was having. So you can actually go to a child psychologist is a best way that he or she can rule out the condition of a child. Okay, so
right,
as speech language pathologist or an occupational therapist, we can able to identify the child as having a problem, but we can't assess, like, we can't name it,
right.
like
True,
my
true.
psychologist can name it as this or this.
Okay. In your practice, whatever the practice that you are doing, and as per your experience, have you found that this language problem has totally been cured for any particular case, or it
In
lingers?
Yes, for when it's for a lot late talkers or who having a lack of stimulation, it's like 100% I have cured. And I
Okay.
had a patient also, she's 18 right now. I didn't understand that, after the therapy, like she had a language disorder. Likewise, she's an autistic kid and she's 18 right now. She speaks fluently and she conveys her needs, she conveys her messages. Yes, on
Okay.
top of it, she has some behavioral issues like self talking, all the stuff. But regardless that, her speech and language have become fluent. And she was only mild autistic kid. So when it's no moderate or severe, it is quite difficult. When it's like mild and the child is having a less behavioral issues, yes, we can able to, for some a longer extent, that child can speak fluently and convey his needs and convey the messages.
Great. Congratulations to you because that is an awesome result that you have got. So, another question which is keeping me busy is that is it that every autistic child will have a speech problem,
Yes. Why? Because speech, language problem. Yes.
language
Like
problem?
it's language problem. Yes. Language is a major thing that we identify for the autistic kid, that the child is not speaking. That is the first thing that parents identify in an autistic kid, where the eye contact or the sitting not sitting or his behaviors will not be identified first. When the child is having poor communication skills, will be notified first for a parent, that suspecting that child is having some problem. So for every autistic kid have will be having problem in this language.
Okay, so one is that autism will have a problem in language as well as Down syndrome. That too.
Yes.
Okay, and repeating a word constantly, like ma'am, good morning, ma'am, good morning, constantly repeating that word. Do you consider, I have seen this in particular in autistic child, repeating a word constantly. Do you think this is also a speech problem or it is something which is typical to autism?
uh, for children who are having autism kids, they might be repeating what we are saying. Its name is echolalia. Okay, if you are saying what is your name, what is your name? That's echolalia. Why? Because child is not knowing what the answer he needs to give. So there is parallel,
Okay,
repeating the same thing, like my name is. Likewise, echolalia is the
okay.
most common thing that we can find for an autistic kid, where his child is a verbal kid. When we are saying something, child repeats back. Why? Because it happens child is not knowing the answer. Okay, so we need to teach them.
Right, right. Okay. My last question to you would be: is family or family history down the line, is it responsible for language problem?
Yes, which I mentioned earlier. Family also play, family history also play a major role. So if a child father had a speech issues, or child father or child mother had a problem in speaking, it can also be like hereditary, like genetical, as we have all those features like of our parents. It can also be transmitted to our children as well. So it is counted as well. So it can be also a reason as well.
That means pathological reason are there. Apart from that, that what you are talking about, the mental shock, that can also lead to a language problem.
Mental shock, why is like if what we are saying is like parent had a mental shock, likewise.
Right, right.
No, like if a parent have like speech and language delay, it can be transmitted, not like mental shock.
Okay,
Okay.
okay. So it is mostly pathological reasons are responsible for this.
Yes.
Okay, okay, fine. So, what are the current researches, Divya, before we end this program? I mean to say, we see really good hopes for recovering from the speech problem. How are things happening in the with you and the medical advancement, how are things taken care of these children? How we are improving in this field? If you can just throw some light on that.
Basically, when we see that before COVID or after COVID hits, the number of children had have an issue in the language as well as speech. Many a number of children have been to virtual autism thing. So what we have to do is that I can say to the parents is the children mentality is as like a good flower. Okay, so we need to plant them. We need to give proper plantation to them, like proper stimulation. Instead of giving phone or instead of giving mobile, talk to them, speak to them, communicate to them. Likewise, we can develop a good future, and children who can speak good can communicate good. So I could say to the parents only that please do have a meditation not giving mobile all time or not giving putting phone all time. Sit there, then listen to them, speak to them, and that's a major thing that you can give
That
them.
means it is curable, and experts like you would be definitely, on a positive note, would be helping, and that is a curable, that is something which is curable. Okay. So thank you, thank you. We don't have any questions as of now. So thank you, Divya. It's a wonderful learning process, and we from Asian College of Teachers, from the entire family of ACT, would like to thank you. Thank you very much. And to the audience, we have been listening to Divya on a very technical topic, and she has made it wonderful. Please click the like button and subscribe to our channel, and click on the bell icon to get all the notifications from Asian College of Teachers. This is Shaunak signing off from Asian College of Teachers, thanking Divya once more for a wonderful live show. Thank you very much.